Welcome. Good afternoon. Welcome to today's Campaign for the Culture event, a conversation with faith leaders, standing up and speaking out against big tobacco. The Campaign for Culture initiative is focused on uniting and empowering, and most of all, educating and engaging people of color and other targeted communities around critical healthcare and human rights issues, such as tobacco use, with the goal of inspiring young community members to avoid or quit tobacco use altogether. Good afternoon. My name is Dr. Jennifer Hawkins, and I'm pleased to serve as your moderator for this afternoon's critical discussion. Today's event is a very exciting one. We have brought together a panel of faith leaders from around the country to talk about the impacts of tobacco use in their communities and really the role faith-based communities can play in fighting it. Faith leaders in particular have seen the disheartening effects of tobacco use in their communities and have used their voice to really speak out, to protect and advocate for their members and their congregation. Faith leaders have been especially impactful in supporting action to prohibit all flavored tobaccos, and because they play a key role in disrupting youth and community initiation and continued use of tobacco products. So I'm always astounded by the facts, and for those who aren't experts in this field, I think it's really important to learn the context. So here are the facts. We know approximately 45,000 Black Americans today die as a result of smoking-related diseases. And each year, lung cancer is the second most common cancer in both African American men and women. And for more than 60 years, the tobacco industry has deliberately targeted Black communities, especially kids, with marketing for menthol cigarettes. In the 1950s, less than 10% of Black smokers used menthol cigarettes. And today, that number is a whopping 85%. We are so thrilled to be partnering with the Center for Black Health and Equity for today's event, as CBHE has been a leader in engaging the faith community in tobacco control work. Our guests today represent places of worship from all corners of our nation and will provide a collective perspective that will speak to all aspects, really, of tobacco use public health crisis that we're in now. We will continue to examine how to prevent tobacco use, encourage cessation, and center the opinions of the church in the fight against tobacco use. We know that nearly 70% of adult smokers want to quit, and more than half try to quit in any given year. I sincerely believe our faith and spiritual leaders can be personal and policy champions to moving the needle and achieving a tobacco-free society for kids, adults, and all the underserved populations. With that, I want to bring in Pastor Ritney Castine, a longtime tobacco control advocate working for the Center for Black Health and Equity and a pastor at Mount Pisgah AME Church in Jersey City, New Jersey. Pastor Ritney.
Hi, good afternoon.
Good afternoon, Pastor Ritney. How are you?
Doing well. How's it going with you?
Very good. We're so excited to have you today and lean on your wisdom and all the work that you've done with youth and the community and your church. I just want to start off with a few questions for you today, but really looking forward to the conversation. You know, Pastor Whitney, you've worked with the Center for Black Health and Equity, which has been a leader engaging the faith community in tobacco control work. Can you share a little bit about an initiative that you've been doing called No Menthol Sunday and the successes really that you've had with the event this year?
Sure. First of all, let me take a moment to thank you, Dr. Hawkins, and the great folks from the Campaign for Tobacco-Free Kids for organizing a time for us to have such a critical conversation with faith leaders in this very important work. I am no stranger to the work at the campaign as someone who's been around for quite some time, even had an opportunity to work for them for a number of years. So kudos for having this time carved out to have this conversation. One of the programs of the Center for Black Health and Equity is No Menthol Sunday. And for the past 7 years, the center has really engaged the faith community and faith leaders and pastors and the like on amplifying this message of living menthol-free and tobacco-free lives through the power of our various congregations, our various synagogues, pulpits, and places where the faithful tend to gather. We've seen over the past 7 years, but in particularly this year, lots of success and even more engagement to where No Menthol Sunday has grown into not being just a national movement, but in fact, it's now an international movement, spurring events all across the country and in fact, all across the world. Some groups, some churches, some congregations have done creative things by employing the toolkit that was developed that allows for people of faith to incorporate tobacco-free messaging, menthol awareness messaging in sermons, corresponded with scripture readings, litanies, church fans, which are very popular in churches as well as encouraging and finding ways to allow for churches to engage the broader community, to include retailers, to try to get them to not sell tobacco products on No Menthol Sunday, which this time around happened to have been on May 15th. And so it has been, really great to watch this initiative grow over time over the past 7 years. And, we have been able to take lessons learned around community engagement strategies to look at what's working in some churches, but to try to amplify those efforts across the broader community as well.
That is fantastic and so encouraging to hear the growth of this initiative, like you said, domestically and internationally. And so, as you think about this work and this initiative, why has engaging the faith community in tobacco control really been a priority in the heart of CBHE? And why do you think it's taken kind of a fire to this and grown so rapidly?
Yeah, I think there's a few things to think of. First of all, when we think specifically about this issue that has brought us together for this conversation today, which is around tobacco use and menthol, I think you set the stage pretty well for us in reminding us that over 45,000 Black folks a year die because of a tobacco-related illness. And certainly the overwhelming majority, some research will point to well over 80% of current smokers are Black folks who happen to smoke menthol products. We know that, that's certainly intertwined together. And if ever we're going to, rid tobacco as the number one cause of death and disease in this country, we've got a lot of work to do in menthol. The other piece of that is that knowing that if we have a lot of work to do in menthol, it means subsequently, we've got a lot of work to do within the African-American community, within the African-American space. What has been true historically also rings true now, and that is that churches, faith, houses of worship, houses of faith have played instrumental roles in the African-American community. And so this gives the churches the tools, the resources, the information in which they're able to engage their own parishioners, as well as, I'm sorry about that, they're able to engage their own parishioners and others on an issue that is really important. I mean, when we look at the most significant thing that could impact public health in this country right now, it's banning menthol. And it's certainly going to be something that could benefit folks of color, African-American people as well.
That's so true. And it clearly, this initiative is important and integrated into the church. And I think that is something that we can all take lessons learned and initiatives that your church is doing. So we know you yourself have been a long-standing advocate and have a long history with tobacco control, but you're also a pastor. So what have you brought from, what has brought you to become a faith leader? I'll start there. And how do you see tobacco and the work against tobacco control informing your life as a preacher and the congregation and frankly, probably all of the youth that you serve as well?
It's really interesting because these are not things that, when I was a kid and writing my 10 and 20-year plan, these are none of the things that I actually thought I'd end up doing. But here I am. Interestingly enough, though, I've been involved both with the church and with tobacco prevention and public health movements all of my life. Clearly having worked on the tobacco side as a youth activist, as a teen, leading campaigns locally and in my beloved state of Louisiana, as well as other places across the country, receiving awards for that work, and then later on being employed professionally for that work, to include stops at the Campaign for Tobacco-Free Kids, running their youth activism department, as well as Truth Initiative, before doing work with the Center for Black Health. But on the other side, I've always been around the church. I've always been a church boy. Served in many different capacities, to include an usher, a musician. I'm a preacher's son myself, and I've always had that nudge, no matter what I've been involved with, certainly on the church side, that it wasn't quite enough and it wasn't quite where I ultimately needed to be. Ultimately ended up answering the call into ministry and serving in ministry as an associate in Washington, D.C., and pastoring in Louisiana, and finally moving to Mount Pisgah AME Church here in Jersey City. And my role in my calling and in how I view ministry is very closely intertwined for how I see the world and how we can benefit public health movements. I don't see church work and ministry as separate and apart, but I see the church, the institution, as a key partner and ally, not just on Sunday mornings, but to helping to make people's lives better every single day of the week. And so, my secular work and my sacred work collide and mesh really well together, in that, I see them go hand in hand. We can use our congregations to raise awareness about menthol, raise awareness about some of the things that the tobacco industry has done historically, as well as what they continue to do, and as well as promoting solutions to where people can get help if they ultimately need it.
I love it. It sounds like you're the perfect person for this job based on all your experience. And it sounds not just your faith work, but obviously the work that you dedicated before even getting into ministry in this space. You truly are an expert in this space. So we are grateful to have you here today. And as we close out, Pastor Ritney, what are you most looking forward to hearing in the conversation today, as we have some of the top faith leaders from across our nation here today to kind of unpack this issue?
Yeah, I look forward to this, because this is like all of my interests sitting on a platter being presented to me at one time. And I'm really excited about this conversation. So I am certainly ready to get myself out of the way and become a student again, to engage intellectually with the panelists. But certainly, I want to hear about how the different faith traditions and the different congregations, faith groups, have been engaged on this topic. Clearly, while this is important to me, this is important to the Center for Black Health, and certainly the Campaign for Tobacco-Free Kids. I want to hear about how these different groups have sort of raised the saliency and the urgency around the notion of tobacco, the notion of banning menthol, and how they've been further engaged in mobilizing their congregants, their parishioners, their members, to take action on this issue. And I'm certainly excited to take lots of notes and to hear and to learn from them what they've been able to do, and even how I can pull away from their ideas, take a few of them and use them and deploy them here at Mount Pisgah in Jersey City.
That's fantastic. And yes, how you guys can work together. I'm just seeing kind of a nationwide intersection of all the leading faith leaders and spiritual leaders across the country, and just pulling from lessons learned that you are doing your individual churches and congregations, and the impact that we can make. So, Pastor Ritney, I thank you so much for your time and dedicating a few minutes to just have a fireside chat with me on all the work that you've been doing. We're going to go ahead and reintroduce our first panel of experts. Can we please have coming to the stage Reverend John Edward Kaiser, Imam Saffet, and Bishop Lisa Way. Welcome.
Thank you. Glad to be with you.
We are so pleased to have you today and just so looking forward to hearing your perspectives and all the work that you've been doing with your congregation and your membership on tobacco usage. I think this is such an important conversation, particularly with you, because of the influence that you have as leaders and pillars in the community. I think people and youth really depend and, lend on your word. So thank you again for making time. I know we are all in very different parts of the country today, dealing with various issues. So we really appreciate you taking the time today to speak with us. So Reverend Kaiser, if I can start with you today, what impact really has tobacco made on your family and on your community? And if you can speak a little bit to that, whether it's people in your congregation or your own personal life in your family.
Well, Dr. Hawkins, I suspect I'm a few years older than you. I'm a kid who grew up in the 60s. And my older siblings were born in the late 40s, early 50s. And I can remember as a little kid in the 60s watching my brother hang out with his boys when they were teenagers in the late 60s, and they all had a look. They wore alpaca sweaters and nicely pressed khaki pants and Stacey Adams shoes and stingy brim hats, and all of them topped out their outfits with king size cools. They all smoked cools with a K, which were marketed to their community, to our community. And you did not see a brother who did not have a square hanging out of his mouth in the 60s. They marketed it with our music. You all probably don't remember when we had cigarette ads on TV, but they specifically targeted our people with mentholated cigarettes, Bel Airs, Cools, whatever. And the brothers particular, can't speak to the sisters because I don't have that experience, but the brothers, you weren't really a man until you knew how to smoke a cigarette. You were 10, 11 years old, and you would go out in the park with your friends and you would practice on how to smoke a cigarette so you could be cool, baby. That was in the 60s. In the early part of 2008, I get a call from a family friend. I'm living in California now, came from Cleveland, get a call from a family friend telling myself and my other sister that my brother, the cool one, is in the hospital. We fly back to Cleveland, discover that my brother has 3 different types of cancer that are stage 4, but the underlying cancer, the foundational one, was lung cancer that he got from basically 43 years of smoking from the age of 15 until he was 58. In fact, he was 57 at the time. I can remember getting into Cleveland on July 12th. His birthday was July 15th. And on July 18th, he was dead just after his 58th birthday. And he'd been a lifetime smoker, became addicted because he started on mentholated cigarettes, as a teenager. With everybody else in the community, we grew up in the Black ghetto, so there was not a deficit of smokers in the community, but smoking killed my brother. My parents had both been able to quit later in life, so they did not succumb to it. My brother did. Many of his contemporaries did, but more than that, as a pastor for these past 30 plus years, the number of members I've had to deal with COPD, emphysema, people having to open up the trachs in their, the holes in their trachs to let smoke out, because even though they had a hole in their throat, they were still trying to smoke. The devastation medically, the devastation financially, and the number of people in my community who have died untimely deaths because they have been targeted by the tobacco community. It's just been so painful and disheartening. And even now, When I go to see members, and I've had members die of COVID-19, I've had members die of COPD, and several die of cancer. All of them were smokers. There is a connection.
Thank you, Reverend Kaiser. I think that is something we can relate to wholeheartedly, the story that you just gave. And I do, even though we're a little bit younger than you. I remember those ads. I remember members in my family, like you said, always having a cigarette in their mouth and practicing because we thought it was a cool thing to do, mimicking our older family members that we would see. Imam Saffet, we're going to turn it over to you. You are the head of the Islamic Society of North America, particularly in the Office of Interfaith and Community Alliances and Government Relations here in Washington, D.C. So we share a great city together. You know, how, in your perspective, what role really does faith play in your passion for social justice and health equity, and particularly tobacco usage, as we're talking about here today?
Thank you so much, Dr. Hawkins, and the wonderful team at the CTFK and the CBHE for organizing this program. Wonderful to be with you. What a blessing to be with you here today. You know, they say that clergy folk have expertise in a couple different areas. I don't know if it's true or not, but we're supposed to. And one of those areas has to do with issues of addiction. And tobacco usage is an addiction. And it's not accidental that the tobacco companies have put together this cocktail of deadly ingredients, 7,000 plus in cigarettes, in order to get us hooked on for life. And it's not an accident that that which harms our lungs, which is connected to this smoking aspect of smoking, is being followed by big oil in terms of what they're doing in terms of burning fossil fuels and polluting the atmosphere and bringing us this climate change. And they borrowed the playbook from the big tobacco companies. So, I mean, I just like to express that I served as a youth organizer, and I serve currently as a Muslim chaplain at a university. And so the issue of tobacco usage is something that is front and center in a lot of the conversations that I have in these particular capacities. The Muslim community here in the United States is a very diverse community. It's probably one of the most diverse faith communities in the country in terms of ethnicity and race. Approximately 1/3 of the Muslim community in America is African American, and the other third hail from different parts of the world in which cultural practices are connected to tobacco usage. It is not necessarily just a cool thing to do, it's sort of the way we've been doing things for a long time, and that is through different types of delivery mechanisms that are not just the cigarettes, for example, the hookah within the Arab world. And these hookah bars and hookah shops are proliferating the country right now in a lot of different neighborhoods, various types of ethnic neighborhoods around the country. So one of the go-to places in terms of the Muslim faith community has to do with the issue of faith itself. Pew Research, as well as different types of polling, reputable polling institutions, have regularly found that Muslims in general in America, irrespective of their ethnic or racial background, identify with being either interested in or very interested in and believe it's important to their lives religious teachings. And so here's sort of the onboarding of how clergy folk come into the picture. Traditionally, within Islam's religious teachings in the pre-modern era, not having access to the medical data with regard to the harms of tobacco had classified tobacco use as, religiously speaking, as something in the spectrum of Islam's religious classification as what's known as makruh. Makruh means something which is disliked but not wholly forbidden. And it was disliked for various reasons, primarily because of its dirtiness. It dirties one's fingers, it dirties one's teeth, and Islam at its core is about purification and it's about cleanliness. And so this idea that you're doing something that causes you to physically cause dirtiness or impurity with regard to that. And so this issue of cleanliness is very central to Islam, and for that reasons, the yellowing of the teeth, the smoke from the nose, and the idea of harming someone that's next to you. The odors that come from tobacco use harm someone that's next to you. So it was classified as makruh. With the modern times, of course, we now have the medical evidence that it's not just something that makes you smell bad and look bad, and but it's something that actually causes harm to one's health and well-being. And the evidence obviously is very, very clear. So it has moved from the category by most religious scholars within the Muslim community from that which is disliked to that which is absolutely forbidden. We're told in the Quran, do not cast yourselves to your own destruction by your hands, or that which your hands play with or use. So obviously this is a central aspect to the idea that it is actually forbidden. And it's the idea here is that it destroys life, it destroys health, it destroys well-being. It harms family. Smoking tobacco harms not only the user, but those who breathe secondhand smoke. It harms one's ability medically to procreate. Fertility rates are linked to smoke, or declines in fertility rates, the ability to procreate and to have children are linked to that. And Islam's sacred law seeks to preserve health, well-being, family, lineage, and wealth. It obviously hits us in the pocketbook, not just the purchasing of the cigarettes and the various other types of delivery mechanisms that are in play now, but also the medical harms, the cost of the medical treatments associated with the illnesses that are tobacco-driven or tobacco-initiated, and the social cost to us all for those who do not have the ability to pay for those medical treatments, as many, unfortunately, people do. So there's a whole host of issues that the Muslim community sort of engages in. And so our challenge is to sort of debunk the cultural practices from the immigrant community by stating that if you hold religion dear, then you have to step away from this type of practice. And there's an interesting usage of tobacco. And there's an interesting part of the Muslim faith tradition is that 1 month out of the year, during the month of Ramadan, when we fast, we're actually forbidden during daylight hours from drinking, from eating, and from allowing anything to pass our mouths, including cigarettes. And so it's basically the idea of addictions. It's a way of breaking those types of addictions. And whether or not someone is, let's say, a fully practicing Muslim or not, they tend to fast and respect the rules of Ramadan. And so the messaging is, if you could do it for 30 days, why can't you do it the rest of your life and leave off of it? And so I think that that's some of the areas that I would like to sort of touch on and mention.
Thank you so much, Imam Saffet. I think the education that you provided around the Islamic faith and tobacco usage is so clear in my mind right now, and particularly the forbiddenness of it. And you brought up the topic of hookah, and I know you have to run in 30 seconds or less. How do you view the current commercialization and consumption of hookah? And you've noticed already that it did target certain neighborhoods. What is your personal view about the consumption?
Well, once again, we thank you for that point. We go to the issue of this is a religious practice, something which is forbidden by the religion. So the cultural practices have to sort of defer to that. I mean, for example, within the United States of America, among the African American brothers and sisters within our faith community, many of them embraced Islam through the Honorable Elijah Muhammad and the Nation of Islam. And that was, they embraced fully this idea of cleanliness and purity of the body. And so this idea of clean up and stand up, type of thing. And this practice needs to be sort of brought with regard to the Muslim world. So one of the things we have, for example, during the Friday sermons is the statement that if we believe in the teachings of Islam as the Quran are, and people affirm it who attend the Friday sermons, then these cultural practices need to be stepped away from. Because if it's forbidden to smoke, it's forbidden to harvest, it's forbidden to transport, it's forbidden to bring out in other ways. And one of the things that helps is the medical aspect of it. When we have, for example, we were very happy to partner with a campaign for tobacco-free kids just a couple of weeks ago during World No Tobacco Day. And one of our medical associations within the Muslim community, the Islamic Medical Association of North America, where the doctors helped to sort of bring about clear evidence and facts, not only with regard to smoking, but with regard to misconceptions, for example, that somehow if you take the tobacco and you inhale it through a water system, which is the sort of the hookah system, it sort of filters it and everything is good because of course water is pure. And sort of debunking that myth. No, it's actually could probably be more harmful than even cigarettes that are normally smoked through the filters. So a lot of it has to do with that type of thing. And you will find that many of the mosque facilities within America are smoke-free facilities. They're very conscious about this. It's not just inside the physical facility, but the parking lot and all areas around. They are smoke-free facilities, and they will quote the verses from the Quran that I mentioned, this idea, do not throw yourself by your destruction, and use the word haram, that smoking is forbidden in our religion. But the hookah bars is definitely a challenge, and part of the pushback against that is clarifying the religious teachings in that matter and having people step away from it. And finding other ways for people to socialize in absence of the hookahs. You know, we got to find constructive and imagine ways in which people can socialize that they don't need to be connected to that which they're poisoning their bodies with. Thank you.
Thank you, Imam, and thank you for joining us today. I know you have to run, and thank you for making all that quite clear for us. So Bishop Dr. Way, thank you for joining us. I would love to hear about how tobacco advocacy really, in your mind, intersects with mental but spiritual health. Where do you see an intersection there, and what have you done in your church to really reinforce that?
Thank you so much, Dr. Hawkins, and to this coalition for putting this very engaging, robust conversation together, and I'm honored to be a part of it. I just wanted to say to Reverend Cager, I remember the ads, and I remember opening Ebony and Jet magazine when I was young and seeing the "You've come a long way, baby," as if to say, you know, once you get these cigarettes, you have arrived. And that's really how generationally it was marketed. And so I've encountered in, you know, my faith community context, I pastor the New Bethlehem Baptist Church in Sandtown, which is in West Baltimore. And many have heard of Sandtown because it's where Freddie Gray lived. And so we are a very socially active church right there in the heart of the community, right at ground zero for a lot of things that are going on. It's a community where you cannot find a bank, you cannot find fresh food, you cannot find physicians' offices, but you can find lottery tickets, liquor, and cigarettes. And so you cannot have a thriving ministry there if you are not actively engaged in, number one, promoting awareness within not just your congregation, but the community. Awareness, information, letting them know what is going on and how harmful the things that we're putting into our bodies are. And then activism. Being engaged. And so, you know, we've hosted the Tobacco Coalition. We've hosted a Black Lungs, Black Lives event where they came and showed a movie. And this was on a Sunday afternoon, so we could easily catch persons, you know, have them stay after church, feed them, and they will stay for those who are trying to figure out how to get them there. And there was so much information, and even our seniors who stayed learned so much, and our young people particularly stayed, and they asked a lot of questions. They even had the dummies there where they showed the lungs and you know what Black lungs actually, you know, look like from the damage from the smoking. And so bringing it in a very personal way, a very real way, and having the dialogue. And so the awareness, the activism, and then the advocacy. And so I've partnered with the coalition right there in Maryland to, we tried to get some legislation passed in our state government, and we will continue to do so. But I think there are multiple levels at which churches can engage. A lot of ministries say, well, I don't know what to do. I don't know how to do it. spreading information, getting involved and partnering with organizations. You don't have to invent the wheel. There are so many ways to engage with those of you who are already doing things. Bring it in and let people have an opportunity to participate in the wellness of our community. We firmly believe, as 3 John 1 and 2 says, we pray that you may prosper and be in good health, even as your soul is well. And so there's a definite intersection between faith, community, and our health, our mental and physical health, because we also understand that a lot of drug abuse, cigarette use, alcohol use is tied to stress and anxiety, not being handled well, and we're passing on our bad habits from generation to generation. And so I'm grateful for this dialogue and this opportunity to expand awareness and help ministries understand that we are vital to this conversation and that we are vital to the community. The church is still the heart and soul of the community, and the voice of the pastor, the voice of the prophet, does still carry weight, and we must use it to speak out to our people and remind them that God has plans to prosper us and not harm us, to give us hope and a future. And we cannot do that if we are unhealthy.
I just want to drop the mic right there. I think that was well said, Bishop Dr. Way. You and Reverend Cager and Imam Saffet have really, to me, talked about a few critical things. You know, the importance, as you said, of not reinventing the wheel. Partnership is important. Engaging each other is important. There's so many organizations like Tobacco Free Kids and others that can assist you in this message. So you do not have to do it by yourselves. And lean on the scripture of whatever your faith may be, whatever spiritual guide, as you've also quoted right here today. There's scripture to lead on to provide a deeper understanding, and the connection of these conversations we know holds so much fruit and value. So thank you, Bishop Dr. Way, Reverend Cager, for your inspiring words and definitely taking us down memory lane, remembering those cool ads in Chet Magazine and Ebony Magazine. I think we can all have a few lessons to learn from older family members and uncles and grandparents who, you know, never let go of a cigarette. And I remember that very vividly in my home. So thank you again for your time. All right, we'll move on to our second panel. We would like to welcome to the stage Reverend Jesse Brown, the senior pastor at Evangelical Lutheran in America Church in Philadelphia, Pennsylvania. Reverend Pharrell Malone, senior pastor at Macedonia Missionary Baptist Church in Waycross, Georgia. And Rabbi Shuley, who is the director of community engagement at Sinai Jerusalem in New York City. And finally, of course, Minister Dr. at Great Friendship Missionary Baptist Church in Minneapolis, Minnesota. Welcome, welcome, welcome. Reverend Brown, I'll start to you. For those who are not speaking, maybe you can just go off mute. I'm hearing a little echo. Just want to make sure we can hear everyone. Great. Reverend Brown, you know, it's well documented that the tobacco industry, for sure, use flavors to hook our youth in, right? And our young adults in tobacco products.
Yes.
How have you seen this played out in your congregation, your community, particularly with flavored cigars or cigarettes?
Well, of course, I am part of a group that started a long time ago, beyond the age of most of this panel, I suspect. Back in 1990, R.J. Reynolds Tobacco Company introduced a new flavored cigarette called Uptown. And they were now paying attention to the Black community. At least that's what they were saying. So they made us a cigarette that was a menthol cigarette that they targeted. They were specifically going to target it to the African-American communities around the nation. I was already working with another coalition that was trying to prevent cancer among Blacks. And with Dr. Bob Robinson and Sharon Sutton and a few others, we were trying to educate our community about those things that cause us harm. And we decided that we were just not going to let the tobacco industry waltz in our neighborhoods in Philadelphia and once again attack us with a new cigarette. And for the first time historically, we stopped the tobacco industry from introducing that product. Because if I ask you to raise your hands, have you seen the new Uptown ads? Nobody will raise their hand because we killed it. But that's not the first time the faith community as a group has pulled together. In fact, it was the faith community who led many of these things. I can name for you a number of people: Reverend Jesse Harris, Reverend Calvin Butts, Reverend Carthens, and a few others, whom were all part of this national movement to stop the industry from targeting us. So we have had a long history. And let me just quickly recite a couple of things for you. Anybody seen any tobacco billboards lately? That's because we helped kill those too. It was the National Association of African Americans for Positive Imagery who saw that advertising was one of the key factors for stopping the industry, not only on billboards, but in magazines and newspapers, at our bus stops, in our cities. And we went after stopping them city by city, state by state when necessary. So I've had a long history with this, and we have had great success because the faith community took the lead to inspire others.
I love that. And I love that we're able to visibly see the action. I know the questions that you asked, have you seen it? Nope, I have not. Not as much as I used to. And thank you for your efforts. And now we know the men and women behind those efforts really fighting behind the scenes to get that down. Rabbi Shuli, can I turn to you? Where do you see Big Tobacco's largest influence in your community and congregation?
Hi, everyone. Thank you. It's wonderful to be here with all of you in this conversation. I just want to say, I understand there's a little bit of a delay with my microphone. So if that's coming up, I apologize for that. So I'm coming from a different perspective. I work at a synagogue on the Upper West Side of Manhattan. Our congregation is a predominantly white congregation. This neighborhood is a diverse neighborhood. And I have young children. So the place where I'm seeing the impact and the influence of Big Tobacco, both within our congregation and also in my neighborhood and in my children's lives, is very much physical. It is in the neighborhood. I recently walked from my home 2 blocks and saw 3 new vaping stores that had recently opened. And they had advertising outside. They had very colorful banners, and they had right at kids' eye level sodas, Doritos, and other fun snacks in the window. So my son, my 9-year-old son, who was walking with me, he saw the sodas and the Doritos, and he said, "Oh, what's that?" And then he looked up and said, "Oh, it's a vape store," because it says vape right on the top. So I think that is a kind of very insidious entry into a community physically with that targeting of children. And that is I would say vaping and e-cigarettes are predominantly the issue for the youth in our community. And seeing how so many young teens and preteens are becoming addicted through these e-cigarettes, and we're seeing the influence of it. They're not advertising in magazines and billboards anymore, but they're opening stores, and that's at least in my neighborhood, I'm seeing that's how that is hooked.
I think we can all relate, particularly in major cities like New York City and others. We are seeing increased vape stores, and kids at a certain age can read and are going to ask questions. And we are left as older adults and communities and parents to answer those very difficult questions in our community. Reverend Pharrell Malone, I want to turn it over to you. Why are faith communities a unique intervention and point of change to really, impact this fight against big tobacco. I think you're muted, Reverend Malone.
Okay, great. I think I'm one of the very few people from the South on this panel, and I thank you all for allowing me to come. I want to thank Reverend Brown for the work that he has been involved with over the years. So thank you for the work and the effectiveness of your work. You give us an awesome example. I think that the church is, and especially in the South, the center of the African American community. It is the way the church goes is the way the community should go. My church is right here in the middle of the hood. What used to be the economic district of the African American community before integration has now become the hood. And I think it is important that the church stays in that community, stay in our community, and effect change, because the church is, I think, the major change agent. The church, our church, stands on the forefront of, we're working with the pandemic. We literally worked with USDA to have 500 truckloads of food throughout the state of Georgia taken to churches to administer. So the churches have impact, and I think the church is the center of the community that brings a level of consciousness and to bring a level of truth. It is left up to us. John chapter 8, verse 32 says, "And you shall know the truth, and the truth shall set you free." So the truth is not just what's in the Bible. It is that smoke kills. It is that smoking kills. And we must be open to the point of delivering that message, whatever that message is, because Hosea 4:6 says, "My people perish." They literally die for a lack of knowledge. And yes, Reverend Cager, oh my goodness. When he brought up the fact of the advertisements, I remember the one that says, "Winston tastes good like a cigarette should." I don't even know that cigarettes should taste good, but I do know this, and this has been reflective as I prepared for this call today. There's 6 of us that are born to my mom and dad. Of course, my dad had a few more down the street and around the corner. But of the 6 that were born in our household, the 2 who have passed were smokers. And I just actually realized that the 2 siblings that have passed are the smokers. My daddy smoked King Edward cigars. And then my daddy smoked something that, as I've gotten ready for this campaign, Vantage menthol. He smoked the menthol. And so the smoking was not just something that he did, but I almost got caught into it because my daddy was my best friend. That's him right there. He was my best friend. And I remember going to college, and one night when I was working as assistant manager at Piggly Wiggly, I was missing my father so much until I picked up a pack of Vantage menthol. I smoked the whole pack. Didn't know what I was doing. Thank God I didn't get hooked. But culturally, generationally, we must stop that curse. And how do we do that? By educating. My daddy died at age 57. He died of heart complications and lung complications that was caused from smoking. So you don't have to go around the corner and down the street to find the essence. It's right here. I remember when deacons in the church used to walk outside the church to take a smoke break around the tree. We've eliminated all of that because, yes, we have a smoke-free campus, but it is incumbent upon us to get the word out. So basically what we're doing this year, what we did last year, we did a 42-city tour. I bought a luxury liner bus, and we went into 42 cities and counties in Georgia to promote 3V, the voters, the vaccines, and the vision of the American Rescue Plan. We're doing a similar tour with the bus, with tobacco-free kids, and we're going through the entire state of Georgia, letting folk know what Hosea says, our people perish for a lack of knowledge, to let them know that smoking does kill. So we must the church must make a proactive. We're doing too many unnecessary funerals too early when it is truly left up to us that we can make an enormous impact.
Those are very keen words that hit home, I think, particularly as you described how it affects your family personally, but the proactive and the prevention measures you're taking in your community. As you say, we're bearing way too many of our family and friends due to tobacco use. Dr. Oakes, I would like to end with you. And this panel has been so super interesting to me, hearing about all the initiatives everyone's doing across the country. You know, you've had some very interesting roles. One as an anti-commercial tobacco grassroots lobbyist and a consultant for the Association of Non-Smokers in Minneapolis. You know, these are very important and keen positions in influencing this space. How have you taken on big tobacco in that role or outside of that role? Reverend, I think you're muted as well.
Thank you for having me, and thank you, Dr. Hawkins, and to all of the others who have gone before with your excellent work. I know God is continuing to bless us as we work towards keeping our communities healthy. But with the Clearway, Minnesota is where I got my initial training. I think most of you know that Minnesota sued the tobacco company along with Blue Cross Blue Shield, and it created Clearway, Minnesota, and there's another group out of California, Appeal, saw our work and wanted to train us as ambassadors to our community to go out and reach. And so we first targeted our legislature, and I was blessed to have a representative from my neighborhood who I had mentored as a child. And he was representing my neighborhood. And then there was another young man who was a senator who I'd known as a child, and his father. So these were some easy ways of getting into the legislature to advocate. We did not have a governor who did support at the time, and we were asking for an increase in the tax on cigarettes to $1.60. And so through our advocacy, we got that. And so our next step was to set out, as we were working with then the African American tobacco leadership and through Brother Del Monte, is to make sure that we were working across the country in concert with the now Center for Black Health and Equity. And so we went to find advocates within each of our communities. Minneapolis and St. Paul is our largest communities in the state of Minnesota. And I live in the zip code, now catch this, zip code with the largest predominant African Americans community in the state. So that's a zip code, okay? So you know where our battle is. It's like the gun legislation. But I went to the city council, and we found individuals in each city who knew a member of the city council. We prepped them, trained them so that they could talk to their city council member. And one thing that one mayor in one suburban city said, they'd asked him about an ordinance and what he supported. He said, the health of our children are more important than money. And so when you find individuals who support you that are elected officials, that's important. And then with the Association of Non-Smokers, they've been around now for about 25 years. And this is what they do, and they do it well. And we formed, we have the tobacco coalition. We have the menthol coalition that's representative of the medical field, the national health organizations, our faith communities, and all of those individuals who have learned that the tobacco industry does not like, and I put this in, Black folks, because if they did, they wouldn't try to kill us. And so we share with them, and I share in my statement, why would you pay someone to kill you?
Wow.
When you buy a pack of cigarettes or a single one, you are paying someone to kill you. And the tobacco industry is the greatest drug dealer beside the pharmaceutical company. And we have one of our African-American funeral homes. And I'd say, you know, if you want to smoke embalming fluid, just go ask Mr. Estes to give you some. You know, if you want, you know, to smoke a paraffin, you know, go buy you something from a store. But looking at all of the things that the tobacco has done in targeting us, we should not be supporting them. They're killing us, our community. And when we die off, they've already got plans for our children through the little Tic Tac and all the little flavored stuff. And they are very tricky. And I say to them, you are not going to rob us of our genius in our community. You're not going to take our children away from us. We are already deprived educationally, so you're not going to rob us and cause us to be ill health. And so that's one of the things that we try to get the message out to the community.
Minister Dr. Hoax. Wow. I think we just taken so much. I mean, not just the response and the work that you're putting in an effort, but, you know, the powerful statement of why would you pay someone to kill you is something I know I would take away and I think resonates with us a lot. So we've heard a lot in this panel discussion. The time goes by way, way too quickly for me. I don't know about you, but you know, the initiatives that you are doing of training ambassadors, the policy legislation that you're influencing. We heard from Rabbi about the visible, noticeable impacts of tobacco in our community that affects our children, and really the power behind faith leadership. From all of Reverend Brown's work. I mean, really visibly seeing, you know, things taken down. And that's what we want to see. So thank you so much for dedicating your time with us this evening.
Dr. Hawkins.
Yes, sir.
Just a note here as we move to closure. I always think it's important for us to leave folks with an opportunity to take action themselves. And I want to suggest that the Center for Black Health Equity is the third generation of our tobacco control efforts. They encompass in them the National Association of African Americans for Positive Imagery and the National Tobacco Prevention Network. And they are now, and it was the church and continues to be the church and church leaders to lead. So I would suggest people to participate in and get their pastors to call Del Monte at the Black Health Equity. I'm sure we can get numbers and everything up for people, but we've got to stop the menthol that is being targeted to us right now. And all of us can act on that from wherever we sit.
Absolutely. And thank you. You are right on ahead of me, Reverend Brown. And I was just going to mention that. So thank you so much for pointing that out. I think action is key. You know, thank you again for joining us today for this important conversation about faith leaders' crucial role, as we've seen and heard today, in the tobacco control movement. I will remind everyone on April 28th in 2022, the FDA issued proposed rules to prohibit menthol cigarettes and flavored cigars. This would be a truly historic action to protect our children from tobacco addiction, advance health equity, and frankly, just save lives, especially amongst the Black Americans and other populations that have been targeted by the tobacco industry. We urge folks to submit comments, to the FDA in support of the rules to prohibit menthol cigarettes and flavored cigars by July 5th. This is a very timely request. It is incredibly important that they hear from the faith community, as well as others, that support for there is prohibiting menthol cigarettes and flavored cigars will protect our nation's kids, advance health equity, and save lives. You can easily submit your comments by visiting tfk.org/menthol or tfk.org/cigars. Please also visit centerforblackhealth.org for all of CBHE's great resources on this issue. Thanks again. Have a good night.